Audrey Horn is retired and her husband works for a small construction company that doesn't offer health care. They've relied on the Affordable Care Act and qualified for subsidies since 2019.
This is our only option for health care. We don't have another way.
Horn's husband has type 2 diabetes. She says they need the Affordable Care Act as they're both several years away from qualifying for Medicare. This year, they've spent thousands out of pocket for his care.
We've already spent $10,000 in 2025 on medical bills and medical prescriptions and doctor's visits and all of that. So this year, we have insurance and we've spent that much.
Over the last 6 years, they haven't seen much of a price change until now. Their healthcare plan increased by about 40%. And because their plan increased, she hoped that the subsidies would too to help offset the costs. But after filling out her enrollment application, she noticed it was up $300 more a month. And if the government doesn't vote to extend the subsidies, they could be paying close to $700 more a month.
This is the monthly payment prior to subsidy. Last year, it was about $1,700. And then we got a subsidy for part of that. This year, the same exact bronze plan went up to $2,400. So $688 more per month.
Plus, healthcare.gov says options on their site are still subject to change, leaving her with questions about what her actual cost will be and influencing her to wait to enroll.
Looking at the enrollment, I'm like, is it misrepresenting the subsidy in healthcare.gov? And I can't get that answer.
Sunday, Representative Don Bacon appeared on CBS's Face the Nation to discuss an extension. Monday, he told me he doesn't want the Affordable Care Act subsidies to expire. Congress must work together. That's why I worked with Reps Tom Swowsey, Jeff Hurd, and Josh Gottheimer to identify a bipartisan path forward on the future of these tax credits, including a 2-year extension, income caps phased out over $200K, and reforms to prevent fraud and clarify benefits.
The deadline to enroll in ACA coverage is December 15th. However, the timeline, or whether or not subsidies will be extended, is still uncertain. In Omaha, I'm Hannah McElry.